The opposition Congress in the state has levelled some serious allegations relating to handling of health amid the COVID pandemic. Leader of opposition and former Chief Minister Mukul Sangma, while speaking to the media after an all-party meet, alleged that ventilators and ICU equipment provided to various civil hospitals were not operationalized, leading to loss of precious lives. Indicating that this is a serious case of underutilization of health infra, Sangma said that the equipment were meant for saving precious lives.
With all the oxygen beds, the ventilators, the ICUs, and so with that kind of presentation that this particular civil hospital is provided with this many oxygen beds for different categories of patients, and also for any critical patients, so many numbers of ventilators have been provided with so many beds of ICUs. But since we were looking at quite a substantial, alarming number of death counts due to this COVID-19, we tried to find out more. And unfortunately, today what we have said is that why have those ventilators which were already provided to respective civil hospitals and other medical facilities were not operationalized? Because they were meant for saving lives of those patients who are likely to go to a very, very critical condition where they require this intervention. And why the ICUs have not been made operational. By doing so, we could have saved many precious lives. These are the concerns that we have shared.
Well, Sangma said that the medical staff were not given proper training to handle the equipment.
They have insisted that all these ICUs and the ventilators which are made available to respective medical infrastructure must be made operational. They were not made operational because to operate an ICU or to put a patient to a ventilator, to intubate the patient, you require appropriate training of the medical fraternity, whoever is assigned with the task. And therefore, this training was not given. Why was this training not given and why was not ICU operationalized? Because we were made to know that the ICUs are there. When you are telling that ICU is there, so many beds of ICU, so many numbers of ventilators, that means we are made to believe that they are operationalized and they are being put to use.
Well, Sangma further alleged that none of the ambulances have basic support life system and advanced life support system.
The districts have this ambulance with both basic life support system and advanced life support system, without which you cannot expect a patient who is on a high flow oxygen to be able to be shifted safely to the destination, a hospital which is equipped with ICU. We have been assured today that new ambulances with advanced life support equipment will be purchased immediately for every district. This should have been done long time ago, because this is how we equip the whole medical fraternity, the frontline workers, with the arsenal.
Meanwhile, Chief Minister Congress Sangma said that all efforts are being made to ensure the situation doesn't go out of control. Sangma further added that the state government is investing on oxygen plants, medication and manpower.
See, we have been very clear from day one that number one, as has mentioned by the Honourable Speaker, that this is an unprecedented situation that we face, and challenges that have never been faced before by any government in the world. This, as mentioned by the Honourable Speaker, is like a warlike situation. So therefore, having a perfect solution and being able to resolve every single issue may not be possible in a situation like this. We need to realize that we are working against limited resources and against time, both. And in both these challenges, which are very, very extreme, we need to do the best we can. So therefore, yes, if you look at it one way, that there are many areas which could have been far better. But we need to realize that we work under very, very difficult constraints. And keeping those situations in mind, I feel that the department and the team has done very well. Now, whether you talk of oxygen, where we had just simply 700 cylinders, today we have 3,000 of them, and many more thousands are coming. We didn't even have one oxygen plant, proper oxygen plant in any of the government units. Today we're going to have it on almost 11 to 12 different hospitals and centers. We didn't even have one cryogenic plant. We're going to have 2 of them. So if you look at that aspect also, it's been in a limited time of less than 30 days, all this work has been done.